You're a little bit better
That's a nice
shot.
one.
So you can see the parts where you're already down to bone.
Yeah.
The one underlying problem here is what we call hip dysplasia. And we're measuring 12 degrees, which normal would be 20 or more.
So based on what you saw, like how do you think I'm gonna be able to run again? Or jump or
I'll say cautiously optimistic.
I've been running my entire life. I've been jumping my entire life. I've been climbing trees. I've been wrestling. When the doctor told me that I couldn't run or jump anymore, I just broke down. I cried in the office. It feels like somebody took part of your soul. My life was crushed.
The average patient's probably going to be 20 to 30. Typically have noticed the slow onset of some hip symptoms.
It was always this constant, like, stabbing pain in my hip. If I sat for too long, I would have a ton of pain. If I exercise or go on a long walk, I'll come back to my truck and I won't be able to lift my right leg. I'll have to pick it up with my hands. Oh.
If we're thinking hip impingement, which is more of a problem of having excess bone in certain parts of the hip, you've got almost this like double kind of bump there.
Yeah.
And then the other is hip dysplasia, which is a shallow hip socket, which leads to hip instability. That's a progression to arthritis. And left untreated, you end up with a hip replacement in your 20s or your early 30s. Instead of having your bone and your cartilage, you now have a hip that's made out of metal and plastic and ceramic. And like anything, made out of those materials, they'll wear out. So what can we do to try to, save or keep my hip? He actually came to me with a few ideas.
It was like talking to one of my friends, somebody that would actually listen to you and not tell you what was going to happen, but hear what was going on and then try and arrive at a solution together. So we decided on the PAO and the Macy procedure.
With the PAO portion of the surgery, we make some very specialized cuts in the bone, so we're able to actually cut the bone below and then above the socket to cut the socket free from the rest of the pelvis. So it's this free piece of bone that then we can reposition, and then we can actually spin that socket bone or turn it so that it covers up the ball more normally. So if we had just done the PAO and not done anything for the cartilage, my concerns would be twofold. So one would be sort of an incomplete resolution of his symptoms. Then secondly, that the arthritis would continue to progress. We take a biopsy of the patient's own cartilage. The cartilage cells are then placed on this membrane. It's a thing that you can put the cells on to put the cells in the defect to allow those cells to begin to reimplant and expand and fill in the cartilage defect. If there are ways to think a little bit outside the box, to factor in what their goals are and come up with solutions, and that's really what I'm trying to do.
I knew Dr. Lewis did a great job on the surgery, but then after that, like the PT side, if you're gonna do the surgery, you really need to commit to that.
The average patient's gonna spend a minimum of 6 weeks on crutches. Then, is really gonna be feeling very good by 6 months. I think it takes a year to fully recover.
It's not easy, but if you want to stay active and you don't wanna have that pain anymore, because it was fairly excruciating, like feeling pain when you're sitting down, when you're standing up, when you're getting out of your car, like in all those situations that you're feeling pain, I don't feel it anymore. I'm gonna get back to everything that I enjoy doing, and knowing that I can do that without a hip replacement was worth every bit of it.
I think it looks great.
heck yeah, man. It feels great.
Good.
Waking up and getting out of bed and like not having to take 3 steps to kind of get myself going, and just being able to get up and go.
Right.
It's amazing.
I'm glad I did it, definitely. And we'll see what happens next. I don't know. Hopefully I'll be able to run.
Yeah, it felt good. Feels like a caged dog getting to run again, you know? You've been broken for so long and then you're just